Great. Looks like some folks are still joining the audio. Give it one more minute here. All right, it is 12:01. We'll get started. Welcome everyone to What's New in Addictions Nursing. And it is my absolute pleasure to introduce Kim Keats, who's a nurse from Vancouver Island. And today we'll be talking about a really, really relevant topic. And so Kim's background is in outreach nursing with youth. And so I'm going to pass it over to Kim to introduce a really relevant topic. And we will have a Q&A at the end of this session. If you do have a question, just a reminder, you won't have access to put your video on or unmute. So if you have a question for us at the end, please feel free to use the chat function or the Q&A function. If you can't find the Q&A function, sometimes it's hiding. It is in the there's a 3 dots more icon at the bottom of your Zoom, and you'll be able to find Q&A in the options that menu brings up. So without further ado, let's go over to Kim Keats.
Hello and welcome, and thank you for being here for my presentation on navigating compassion fatigue and building resilience. Today, we'll explore the emotional challenges healthcare providers encounter, such as compassion fatigue, burnout, and trauma. This session is designed to acknowledge those difficulties while providing feedback tools to strengthen resilience, support well-being, and foster satisfaction in your work. I encourage you to reflect on your experiences and see this as an opportunity for both professional growth and self-care. First, I'd like to complete my territorial acknowledgement. I respectfully acknowledge that I live and work as an uninvited settler on the traditional, ancestral, and unceded territories of the Coast Salish peoples. Specifically, I want to respectfully acknowledge that the land on which I work is the unceded and traditional territory of the Wasanic, Algonquin, and Songhees peoples. With deep gratitude, I honor the Coast Salish people's enduring connection to these lands, waters, and communities, and recognize Coast Salish people's ongoing stewardship that continues from time immemorial. This territorial acknowledgement recognizes the enduring presence and contribution of Indigenous communities and the importance of honoring their history and culture. In the context of this presentation, it reminds us to approach care with humility. Compassion fatigue is not a sign of weakness. It is the sign of caring deeply. Caring for people who use substances is extending the gift of compassion and commitment. This work allows us to walk alongside individuals in their most vulnerable moments, to offer hope, understanding, and connection. Yet it can also weigh heavily on our hearts. In this discussion, we want to honor the emotional toll that comes with supporting unique and challenging clients and patients, while recognizing the courage and humanity it takes to continue showing up every day for work. Together, we'll explore how embracing support systems and nurturing resilience can help sustain our capacity to care with compassion and integrity. Our objectives today will start by defining compassion fatigue. We're going to highlight its emotional toll and how it emerges in caregiving roles. Then we'll examine its consequences, including the impact of systemic barriers like stigma, resource shortages, and which intensify its effect on caregivers and organizations. Next, we'll explore practical strategies for prevention and management, such as reflective supervision, peer support, and trauma-informed leadership. Finally, we'll discuss organizational approaches focusing on creating supportive work environments, flexible policies, and recognition programs to promote caregiver well-being and resilience. The weight of this topic, discussions about compassion fatigue can bring up emotions, and it's natural to feel discomfort, sadness, or even feel overwhelmed when you reflect on these challenges. Your emotions are valid. They reflect the care and empathy that you bring to your work. Engaging with this topic demonstrates your commitment to creating positive impact for both yourself and those you care for. Pause and reflection. I invite you to take a moment to pause and process as needed. Give yourself permission to breathe, reflect, and embrace moments of connection, both through self-compassion and through your own thoughts as we move through this discussion. Where did compassion fatigue come from? The concept of compassion fatigue has evolved significantly over time. In 1961, Norman Cousins described how society can become less sensitive to the suffering of others. Carla Joynson introduced the term compassion fatigue officially in 1992, when she focused on nurses' emotional exhaustion. In 1995, Charles Figley expanded compassion fatigue further, linking it to secondary traumatic stress. And then by the 2000s, the research kind of exploded into various caregiving professions, highlighting the importance of systemic solutions. What are the 5 stages of compassion fatigue? The 5 stages of compassion fatigue really provide a lens to understand how the emotional demands of caregiving evolves over time. Well, this framework, it's not really tied to a single researcher. It builds on the foundational work of pioneers like Charles Figley and Carla Joynson. Figley illuminated how secondary trauma profoundly affects caregivers, while Joynson highlighted the unique struggles that nurses face, the emotional exhaustion, the constant giving, and the overwhelming sense of being stretched too thin. Over time, others have expanded this understanding, linking compassion fatigue to measurable factors like compassion satisfaction and burnout, while emphasizing the systemic changes like high workload and lack of support, and these compound the effects. What's vital to remember is that these stages aren't abstract concepts. They reflect the lived realities of caregiving. This framework helps us recognize the journey from early exhaustion to more profound emotional struggles, while reminding us of the importance of action. It serves as a bridge between research and reality, guiding us towards responding with compassion, humanity, and a meaningful change. There's stages of compassion fatigue. So I've broken it up into 2 different components during this presentation. So first, we're going to talk about the early stages. The compassion experience is when caregivers feel deeply to their work and they find meaning in helping others. This engagement might be reflected in actions such as spending extra time with patients to ensure they're comfortable, or volunteering for additional overtime shifts, or mentoring newer colleagues. While fulfilling these, the behaviors can lead to increased vulnerability, such as emotional demands grow over time. The compassion decline has subtle signs of emotional exhaustion. For example, nurses might start skipping breaks, maybe, to catch up on tasks, or sacrificing their personal time to complete patient education or documentation, or dismissing their own need for rest and self-care, thinking they can just power through it all. These actions are often unintentional, as caregivers remain unaware of their mounting emotional fatigue. The compassion discomfort phase is when frustration and doubt start to creep in. It's driven by pressures of like high workloads and unmet expectations. Nurses may begin avoiding emotional demanding interactions, such as hesitating to engage in long conversations with patients or families. They might also display signs of impatience, such as rushing through tasks or feeling resentful about additional responsibilities. Even when striving, they're still trying to be professional, so they're striving to maintain their professionalism. External pressures amplify these actions, leaving caregivers feeling increasingly overwhelmed. What are some early signs of compassion fatigue? I guess spotting these early signs of compassion fatigue really requires you paying attention to little shifts in behavior and emotional responses. Some caregivers might become easily irritated with struggle and with persistent exhaustion, while others may withdraw from colleagues or lose interest in activities they once enjoyed. These behaviors may also manifest physically with symptoms like headaches, stomach discomforts, or changes in your sleep. By understanding how these signs can vary across individuals, we can gain a deeper insight into the complexities of compassion fatigue. Compassion fatigue, when I did my research, it is such a complex and layered issue that it's hard to capture all its nuances in a presentation. That's why we're going to focus on a case study to give us a kind of a real world example of how compassion fatigue affects caregivers, and more importantly, how it can be addressed. Drawing on insights from Flaherty et al. And Dowdell et al., we will look at how these strategies like peer support, mindfulness, resilience training, and organizational changes made a real difference. This case study connects the research to practical solutions and hopefully will show us how we can turn understanding into meaningful action. Let's dive into the case study and see how compassion fatigue played out in a real-world setting. In this emergency department, staff were dealing with high turnover and early warning signs of compassion fatigue. The nurses were emotionally exhausted, worn down by the intense high-stress environment and the constant exposure to patient trauma. Over time, their ability to sustain empathy started to fade, especially when working with patients who came back to the hospital with recurring challenges. Many of them began to feel a deep sense of discomfort and self-doubt, questioning their ability to meet patient needs, and they began to wonder, is this nursing role or this caregiving role for me? This case study will help us connect the theory to the reality of caregiving. So let's look at the second part of compassion fatigue, which is the advanced stages. In the compassion distress period, caregivers or nurses or healthcare professionals can start to show signs of significant emotional strain. You might notice them avoiding emotionally challenging tasks, like having really tough conversations with patients or families. And instead, they're going to focus on the more technical parts of their work. Feelings of frustration and helplessness often start to surface, straining the relationships between colleagues, and it leaves you feeling more isolated. During this time, caregivers may begin to question their skills and wondering if they're actually capable of remaining in their current role. If this distress isn't addressed, it can escalate into full-blown compassion fatigue. At this stage, caregivers often feel completely exhausted, physically, emotionally, and mentally. They might start arriving late, missing shifts, avoiding team discussions, staff meetings, and avoiding the lunchroom. This emotional detachment becomes noticeable with the lack of empathy and patience in their interactions. They're sharp, they're challenged, they're that nurse or that person that you just don't want to work with. Some may even disengage from their professional responsibilities or begin seriously thinking about leaving this role altogether. What are some signs? Spotting signs of advanced compassion fatigue means recognizing more severe and lasting impact it has on its caregivers. Physically, caregivers might be experiencing chronic pain and reoccurring illnesses like the cold that just doesn't go away, or constant exhaustion, signaling the toll on their bodies. Emotionally, feelings of detachment and cynicism often deepen, leaving some caregivers feeling disconnected from the work they once found meaningful. This stage isn't about emotional strain anymore. It's about a fundamental shift in how caregivers see their roles and their ability to cope. These advanced signs underline the critical need for timely intervention. And in the next section, our case study will illustrate how these challenges played out in real caregiving environments. And we're going to look at the interventions used to support those who are impacted. A progression to the advanced stage of compassion fatigue reveals significant emotional and professional challenges, as illustrated in our case study of emergency room nurses. Emotional detachment and reduced empathy. The nurses struggle to connect with patients and colleagues, physically and emotionally, feeling the toll of prolonged trauma exposure. Strained relationships. Withdrawal from professional and personal relationships became more evident, leading to isolation and decreased use of support systems. Decreased job commitment and morale. Hit through motivation and productivity visibly declined. With some nurses, they needed to take leave. Addressing these signs early is critical to reduce deeper impacts on individuals, teams, and organizations. This brings us to an important distinction: compassion fatigue versus burnout, which we'll explore on the next slide. Compassion fatigue arises from the emotional labor of caring, caregiving, and repeated exposure to others' trauma. It often leads to emotional exhaustion, numbness, or detachment. Burnout, on the other hand, stems from chronic stress and excessive workloads, often resulting in frustration, disengagement, and decreased productivity. While both have profound impacts, their causes differ and require tailored interventions. For example, compassion fatigue benefits from strategies focused on emotional restoration and addressing secondary trauma, such as peer support and mindfulness. In contrast, burnout often calls for systemic changes, like reducing workloads and improving organizational supports. Recognizing these distinctions is essential to developing effective strategies. This brings us to the key question: how can we measure the progression of compassion fatigue to ensure our interventions are evidence-based and impactful? I'd like to introduce the Professional Quality of Life tool. Developed by Dr. Beth Ham in 2010, it's a widely recognized method for understanding caregiver well-being. It evaluates three critical areas. Compassion satisfaction. This measures the positive feelings caregivers experience from their work, like finding purpose and fulfillment. Burnout. This focuses on emotional exhaustion caused by chronic stress, helping us identify where additional supports are needed. And it also evaluates secondary traumatic stress. This captures the emotional toll caregivers face from being indirectly exposed to trauma, which is especially common in healthcare. By assessing these three areas, the Professional Quality of Life tool provides a clear framework for identifying and addressing compassion fatigue. This tool helps connect theory to practice and lays the groundwork for real-world applications, as we'll explore in our case study. Compassion fatigue, burnout, and secondary traumatic stress, as we discussed, are three distinct but interconnected challenges faced by healthcare professionals. Compassion fatigue stems from emotional labor of caregiving and is often heightened by repeated exposure to suffering. Burnout develops from chronic stress, as we discussed, and is caused by heavy workloads, inadequate resources, and organizational pressures. Secondary traumatic stress arises when caregivers are indirectly affected by the trauma of their patients, experiencing emotional distress as a result. While these phenomena are distinct, they frequently overlap, amplifying the emotional and physical effect on caregivers. Understanding these connections provides a critical foundation for addressing the challenges effectively. In the next section, we'll explore strategies that address these issues and support the well-being of healthcare professionals. In our case study, caregivers face 3 unique challenges that highlight the emotional, relational, and professional toll of compassion fatigue. They noted diminished compassion satisfaction. While staff found fulfillment in moments of patient progress, stigma directed towards people who use drugs and overwhelming workloads diminished their sense of purpose. Burnout, high turnover, long hours, insufficient staffing created emotional exhaustion, leaving many caregivers physically and mentally drained. Secondary traumatic stress, repeated exposure to trauma like overdoses and relapses led to emotional detachment as caregivers tried to cope with the ongoing stresses. These challenges illustrate why it is so important to identify the earlier signs of compassion fatigue and address its progression. Let's explore the 5 stages model again, a framework designed to help us better understand this process. The 5 stages model offers a way to recognize and address the progression of compassion fatigue. While it begins with subtle signs of emotional exhaustion, such as skipping breaks and avoiding self-care, it can escalate to more profound struggles like frustration, detachment, and reduced empathy. Individual strategies such as mindfulness, peer support are essential to addressing early signs. However, systemic factors like high workloads, limited resources often amplify these challenges and require a broader organizational support system. This model highlights the importance of combining individual and systemic approaches to sustain caregivers. As we've seen, systemic factors can either support or undermine caregivers' well-being. Now let's dive deeper into the systemic drivers of compassion fatigue. Compassion fatigue just isn't an individual issue. It's also deeply influenced by systemic challenges. Workloads and caseloads, high patient demands, frequent exposure to trauma, and staffing shortages create overwhelming environments. Limited resources. Many caregivers lack access to mental health support, professional development, and stress management tools, which increases their vulnerability to compassion fatigue. Organizational culture, which we call a do more with less mindset, often prioritizes production over well-being. Systemic stigma, both towards caregivers and patients, adds another layer of strain. Addressing these factors requires accountability at the organizational level. By tackling these systemic issues, we can foster environments that better support caregivers and promote resilience. Substance use care presents unique challenges for healthcare providers, increasing their risk of compassion fatigue. So I'd like to build on Vicki Reynolds' framework and focus on 3 distinct areas. The first one is collective care. Use peer support groups and team building debriefings to build shared responsibility and connection among caregivers. Trauma-informed practices. Train healthcare providers to address trauma in both patients and staff, reducing secondary trauma and improving empathetic care. Ethical frameworks. Implementing harm reduction and dignity-centered policies to create supportive work environments for both patients and caregivers. These principles provide a pathway not only to reduce compassion fatigue, but also create healthy, more sustainable work environments for caregivers. Substance use care highlights the importance of collective and ethical approaches. But addressing compassion fatigue requires a broader holistic approach that integrates both individual and systemic strategies. Let's explore how these perspectives come together. Compassion fatigue is often driven by a combination of systemic pressures and individual challenges, as we've noted previously. To address this effectively, solutions must focus on both levels. We need to implement individual resilience building strategies. Strategies like mindfulness, self-care, and setting boundaries will empower healthcare professionals to manage stress and maintain emotional well-being. systemic changes to support caregivers. Addressing issues such as high workloads, limited resources, and organizational culture is critical. This includes creating trauma-informed workplaces, fostering peer support, and improving access to mental health resources. Integrating these approaches creates sustainable caregiving environments where individuals can thrive within a supportive system. This combination is key to fostering long-term resilience and addressing compassion fatigue holistically. Understanding the value of individual and systemic approaches is critical, but evidence-based strategies ensure we can deliver real life, measurable results. Let's explore interventions that have made an impact in caregiving roles. Addressing compassion fatigue requires both individuals and systemic strategies. I keep saying, but it's important to realize this, as the challenges may affect caregivers on multiple levels. As an individual, we're looking at mindfulness, self-care, and setting boundaries, as we said. But these practices are critical for navigating the emotional demands. We're also looking at trauma-informed workplaces for fostering environments where you feel safe and supported. And peer support, it creates a culture of connection and shared responsibility. Access to mental health resources ensures that you'll have tools you need to address ongoing challenges. One example of evidence-based intervention is the use of the professional quality of life tool in emergency departments. Let's examine how this initiative was implemented to address compassion fatigue among nurses. Continuing with our case study, the professional quality of life tool was implemented in emergency departments to help address compassion fatigue among nurses. This initiative introduced an educational program designed to provide staff with evidence-based tools to recognize and manage the emotional challenges of caregiving. The program focused on 3 core strategies: reflection, encouraging nurses to pause and process their experience to gain a deeper self-awareness; self-regulation, encouraging nurses to, equipping staff with techniques to manage stress and build emotional resilience; and team support, fostering strong peer connections and collaboration to reduce isolation and strengthen resilience. This program, it really laid the foundation for meaningful change in the emergency department, and it helped nurses better navigate the demands on their roles. After implementing the professional quality of life tool and related interventions, what were the measurable outcomes? Let's review the results and see how this impacted caregivers. This slide highlights the results of the professional quality of life tool and the assessments that they received from implementing. The assessments were conducted before and after the intervention. These findings showcase the measurable impact of educational programs on compassion satisfaction, burnout, and secondary traumatic stress among emergency nurses. The first one, compassion satisfaction. Scores increased by 1.9 points, which is a 10% improvement. This indicates that the participants felt a stronger sense of purpose and fulfillment in their caregiving roles after the intervention. Burnout. Scores decreased by 3.9 points, or a 16% reduction. This significant reduction demonstrates the effectiveness of interventions in reducing emotional exhaustion and feelings of depersonalization. Secondary traumatic stress. The scores improved by 2.1 points, or 9%. This reflects enhanced emotional resilience and an improved ability to cope with stress related to secondary trauma. After implementing the professional quality of life tool and related interventions, let's see how we go into fostering resilience. The 5-stage model and systemic solutions foster essential frameworks for understanding compassion fatigue. These approaches provide both the theoretical and practical insights into the progression of emotional exhaustion and the systemic factors that exacerbate it. However, where does the true value lie? It lies in translating these insights into actionable strategies. tailored to high-stress caregiving environments such as substance use care. Compassion satisfaction is a key component of the professional quality of life framework, and it serves as a protective factor against compassion fatigue. It helps the caregiver reconnect with their sense of purpose. It fosters positivity and fulfillment and a renewed meaning in their work. By nurturing compassion satisfaction, healthcare providers can build emotional resilience and sustain their well-being, even in challenging settings. Compassion satisfaction. What is this? Compassion satisfaction offers caregivers a sense of fulfillment that helps them navigate emotional challenges of their work. Pardon me. STAMP highlights its critical role in building resilience, enabling caregivers to remain strong and effective even in high-stress environments. Our case studies by Flaherty et al. And Dowdell et al. Demonstrate how targeted interventions such as education, guided imagery, peer support, and intentional caregiving significantly improve compassion satisfaction. These strategies help reduce emotional exhaustion, enhance engagement, and reconnect caregivers with their purpose, fostering long-term well-being. But this isn't just about individual resilience. Compassion satisfaction also benefits organizations by fostering a culture of engagement and connection. Resilient caregivers create thriving environments where both staff and patients feel supported. By prioritizing compassion satisfaction, organizations can move beyond just addressing challenges to building sustainable systems that empower everyone to thrive. As we've seen, compassion satisfaction is a key factor in caregiver resilience. Now let's explore how fostering it translates into meaningful change for individuals and organizations. Organizations play a critical role in mitigating compassion fatigue by addressing systemic and cultural changes. First, Vicki Reynolds. Vicki Reynolds emphasizes justice doing, which ensures organizations take ethical responsibility and address systemic inequities that impact caregiving needs. Poole highlights the importance of combating stigma, not just towards patients, like people who use substances, but also towards caregivers who are struggling, because we want to foster a culture of respect and support. Flaherty et al. And Dowdell et al. Underscore the impact of systemic barriers such as resource shortages and high caseloads, which contribute to caregiver stress. Recognizing and addressing these barriers is essential for meaningful change. Finally, fostering compassion satisfaction, as Stam and Flaherty et al. Describe, allows caregivers to reconnect with their sense of fulfillment and purpose. This builds resilience and creates thriving care environments. While compassion satisfaction strengthens individual resilience, organizations also have to play a vital role. Leadership is hand in hand with organizations. Leadership plays a crucial role in addressing compassion fatigue by fostering environments where caregivers feel supported, valued, and connected. Joynson underscored the importance of validating the emotional toll caregiving takes on staff, encouraging leaders to create spaces where challenges can be openly discussed and addressed. And research by Cocker and Joss highlighted trauma-informed leadership practices, emphasizing the need for emotional safety and reflective supervision to mitigate secondary trauma. Lastly, Dowdell et al. Stressed the significance of fostering peer connections and safe spaces for debriefing. These strategies not only reduced isolation, but also strengthened team resilience, reinforcing a culture of care and collaboration within caregiving environments. This slide focuses on systemic strategies organizations can implement to foster resilience among caregivers. Flexible policies such as manageable workloads and paid mental health days provide caregivers with the space to recharge, improving both morale and productivity. Trauma-informed practices, as emphasized by Gabor Mate, ensure that organizations prioritize empathy and understanding, creating a safe environment for caregivers and clients alike. Lastly, ongoing education and professional development empowers staff to adapt to challenges and feel supported in their growth. These approaches establish the foundations for a resilient, thriving workforce by addressing the systemic barriers that often lead to compassion fatigue. To make systemic changes more sustainable, organizations need practical tools and frameworks. Building on systemic approaches, this slide highlights practical tools that organizations can adopt to drive meaningful change. The Professional Quality of Life tool developed by STAM provides that standardized way to measure compassion, satisfaction, burnout, and secondary traumatic stress. This will offer us valuable insights into staff well-being and allows you to track to see if the interventions that you're putting in are effective. Education and training programs help caregivers build skills to manage emotional strain. And justice doing frameworks championed by Vicki Reynolds emphasizes embedding equity and dignity into organizational systems to ensure that caregivers feel valued and supported. The tools and strategies we've discussed have demonstrated measurable success. Let's look at the outcomes from our case study to see how these efforts improve caregiver well-being. To conclude our case study, this slide highlights the outcomes of the targeted organizational strategies implemented to address compassion fatigue among caregivers. There was tailored training and peer support. These interventions provide caregivers with practical tools to navigate emotional challenges. They also fostered collaboration and strengthened team connections. Stress relief practices, techniques like guided imagery, were introduced to help caregivers develop self-regulation skills. These practices enabled them to manage emotional demands more effectively and build long-term resilience. Professional quality of life tool tracked measurable improvements in key areas, which we've discussed: the compassion, satisfaction, burnout, and secondary traumatic stress. The outcomes of our case study demonstrated the significant impact of targeted interventions in addressing compassion fatigue. But to ensure continued success and improvement, it's essential to evaluate progress systematically, like we talked about. Let's explore the tools and metrics that you might use to do that. This slide outlines the metrics that organizations can use to address the effectiveness of their strategies in addressing compassion fatigue and fostering resilience. Burnout rates. Tracking burnout reduction provides valuable insight into the success of the interventions. When you observe patterns over time, organizations can determine which strategies are working, and then they can kind of make adjustments to address those lingering challenges. Compassion satisfaction scores. By monitoring compassion satisfaction, it will offer a clear view into the emotional resilience and fulfillment. Higher scores indicated that the staff felt supported and engaged and purposeful in their roles. And these are all essential factors for well-being and professional satisfaction. Workforce retention rates. Retention rates serve as a practical indicator of how effectively organizational strategies create a positive work environment. High retention rates reflect supportive culture where caregivers feel valued, reducing turnover and strengthening team cohesion. These metrics highlight the importance of evidence-based evaluations to guide and refine strategies and ensure sustainable support for the long term. This slide highlights organizational strategies designed to ensure sustained success. Oh my gosh, that's hard to say. Sustained success in mitigating compassion fatigue and fostering caregiver well-being in the long run. Feedback loops. Establishing continuous feedback loops allows organizations to adapt and refine strategies based on staff input. They want to know what you know. They want to know how you feel. Regularly gathering and integrating feedback ensures that interventions remain responsive to evolving challenges, and that empowers the caregivers by giving them a voice in the decision-making. Embedding ethical practices. Sustainable change is rooted in ethical principles such as equity, dignity, and collective care. By embedding these values in organizational culture and policies, leaders can create supportive environments where caregivers feel respected, valued, but most importantly, emotionally safe. Expanding best practices, sharing and scaling evidence-based strategies across teams. So this approach ensures that successful interventions benefit all caregivers, creating a culture of shared responsibility and collective resilience. We share what we know. That's what healthcare is about. These strategies emphasize the importance of long-term commitment to creating resilient caregiving environments, but we want it to, and it is prioritizing both individual well-being and organizational effectiveness. Compassion fatigue often sneaks in subtly, making itself as it masks itself as an everyday stress until it leaves you feeling physically and emotionally drained. Recognizing the warning signs such as persistent fatigue, irritability, difficulty concentrating is essential to healing. By setting boundaries and redefining productivity and incorporating intentional self-care practices, you can restore balance and build up resilience and create a safe, productive space for a fulfilling life. Sometimes we need extra supports. So this slide I have put in healthcare providers across BC actually have a range of resources designed to address compassion fatigue and enhance their resilience. There's 3 key supports that I found. They had quite a bit of information on them on the internet. The first one is Care for Caregivers. It's an online hub that offers tailored mental health resources, webinars, and information to address the psychological well-being of healthcare workers. The Canadian Mental Health Association, the BC division, they have workshops that provide education and practical strategies to help manage compassion fatigue and foster there's a deeper understanding of its impact. Safe Care BC. This organization equips caregivers with a variety of psychological and emotional wellness tools, such as webinars, topic-based resources, all designed to kind of support your well-being. In summary, the journey of caregiving is one of shared responsibility. It asks us to walk together, supporting each other along the way, so that we can continue to care with compassion and strength. Today, we've explored the interconnection of compassion fatigue, burnout, and trauma, and that addressing these issues often requires a multifaceted approach, combining individual and systemic strategies for meaningful change. Through collaboration, commitment, and evidence-based practices, we can build environments where caregivers feel supported, clients receive quality care, and organizations thrive. This beautiful image captures the essence of caregiving, a shared journey where we support one another as we navigate the challenges and celebrate the moments of connection. As Gabor Mate's work reminds us, caregiving is not a solitary path. It's one we walk together, grounded in compassion and collective strength. By focusing on shared responsibility and systemic supports, we can ensure that caregivers not only are sustained, but thrive in their vital roles. This presentation has emphasized the importance of compassion satisfaction, systemic change, and ethical practices as a cornerstone of resilience. Together, we can create a culture that uplifts everyone involved in this process. And that concludes my presentation.
Thanks so much, Kim. I almost want to take like a pause because this picture is so great. It's taking care of, taking care on so many levels. What a relevant topic. Thanks so much, Kim. We have some time for questions. So again, if you have a question, please feel free to use the Q&A function or the chat. There is a question from Emma. For you, Kim, is there somewhere that leadership could find out more about how to offer or implement reflective supervision?
Oh, that's a really great question. And you know what, Emma, I'm just thinking back, sorry, the presentation was it's quite an overwhelming topic. And leadership does play an integral role in mitigating compassion fatigue. I found that I've done a different presentation that was quite less science, like kind of research based. And I would say for the most part, the folks that I've spoken to do not feel supported by leadership. So I don't know if it's a hiccup in what we offer or just that maybe we're just so overwhelmed right now that leadership just can't kind of get moving forward. I do know that sometimes change can start with the little people in the beginning, and maybe the change has to start with frontline workers and just acknowledging what compassion fatigue is and what burnout is and what secondary trauma effects are, and bring it to our leaders when we have our staff meetings. And sorry, I can't answer your question fully.
Yeah, there's a lot there. But thanks, Kim. Moving along so we can try and cover more questions here. There's a comment from Fernanda. Beautiful presentation, important topic, and very validating. Thank you for talking about personal strategies as well as systemic strategies, which are validating in themselves. Yeah. Okay, I'm going to go to the other questions here. Okay. Okay, interesting comment from Yumi that was in the chat. Just about if we might sometimes a balance between putting too much emphasis on compassion or caring or a sense of purpose when in reality a lot of the time it's maybe that's your job and that's how you separate that instead of it being like a purpose for you. So I'm wondering if you have any thoughts on that, wondering if, there's this systemic views of caregivers being compassionate people and we're in this profession because that's our purpose, if that could be something that's contributing to how we're um, maybe needing to detach ourselves a little bit. What do you think, Kim?
So I think that I think compassion fatigue sneaks in. I think that maybe we've chosen to be in this profession, in the helping profession, as nurses or as physicians or counselors, and that is our intent. And some folks come into this and they have strategies in place and they're already taking care, like self-care, and they're taking time for themselves and they're doing that reflective thought process within themselves. But what I'm seeing and the research and what I'm seeing out there is that there's a lot of folks in a wide range of ages where they're tired and they don't know why, or they just keep going. They just keep going and they're doing the job, but they're doing it just a little bit less and a little bit less and a little bit less with the compassionate side. Maybe we need a study that will look at this. If we look at folks that are successful and they feel that they are not fully affected by compassion decline or compassion fatigue, and then we can look at the folks that absolutely have left the profession because they just can't cope or manage anymore and figure out what they do. I mean, that's what the BCCSU we can look at that through a study maybe. It would be interesting to find out. Thank you, Yumi, for your thoughts.
Thanks, Kim. Yeah, really, really awesome just to get a sense of that, of like, oh, does appropriate detaching at certain points actually help, right? We have a lot more work that we can do on that. And definitely there's just a lot happening in healthcare right now. So very relevant topic. Gonna quickly look around to see if there's any more questions here. I actually do have a question if there are no more. Let me just see here. Lots of comments for you, Kim, just about the important topic, the difference between compassion fatigue and burnout, which seem to really be important for folks. So, okay, let's see. Yes. So, question from Emma. Curious, we've known about this topic and this issue for decades, a very long time. Did you find any organizational commitments to addressing it? Not so much you do the self-care like as an individual, but as an organization actually having a commitment.
Um, I didn't come across any of that in my official kind of research as I moved along because it was very focused on compassion fatigue and just the progression through that. But I'm just not, what I see is that there are organizations out there that are recognizing this and they're providing, as we had a little meeting and they were providing recognition in like a lunch and learn where you could go in and they could talk about compassion fatigue. But honest to goodness, what I really have found that people want more. They want more of these presentations. They want someone to talk about it. They want to sit at a round table and have these discussions. So maybe that is the next kind of steps as we move through. Sorry.
Yeah, no, of course. Yeah, and was just, wondering what we can do because
I know.
it affects
It's
folks a lot.
it does. It affects a lot of people and anywhere from the folks that like patients or clients in the hospital all the way up. Like there just is this huge challenge and it's so big. I don't think that we could, I for sure as a nurse, I don't feel qualified to even tackle how we would bring systemic changes in. But I think by sitting together and learning from each other and finding out what is going on and what our goals are, what do we want and how are we feeling is the way to approach it.
Yeah, thanks so much, Kim. Highlighting that there's really there's room for so many ways to look at this, things that we can do, and more we can look at in terms of what has worked in the past and what doesn't work, and maybe our own way of looking at it maybe isn't working either. So it's just a lot going on, and I super appreciate everyone coming to the What's New today. Going to look at the time and start to close down the discussions and all that. So, okay. All right, let's see. Yes, Kim, you worked really hard on this, and it's a really big gift to us all, as Emma had mentioned in the chat. Thanks, folks, for joining today. We'll give folks 5 minutes back, or if you want to linger for 5 minutes and put some comments in the chat, we will be around for that.